Welcome back for another deep dive. Today we're going to be looking at something pretty interesting. Psychosis caused by medical conditions. You guys sent in a ton of stuff for this one. Medical journals, research articles, even personal notes. Seems like this is something you really want to get to the bottom of.
It is a topic that tends to surprise people. I think we tend to think of mental and physical health as separate, but the truth is they're much more connected than we often realize.
Yeah, totally. I mean, like, stress can make you feel sick, right? But to think that a vitamin deficiency or something could actually cause hallucinations, that just seems crazy. So where do we even start with something like this?
Well, first, I think we need to clarify what psychosis really even means. It's not a disease in itself, but more like a cluster of symptoms that suggest a break from reality is happening.
Okay, so it's like a symptom, not the root cause.
Right. It's kind of like a warning light on your car's dashboard. It tells you something's wrong, but not exactly what.
Makes sense. So what kind of symptoms would fall under that psychosis umbrella?
The big three are delusions, hallucinations, and disorganized thinking. Delusions are like these fixed, false beliefs that someone holds on to no matter what, even if there's evidence proving them wrong. Hallucinations are when someone experiences sensory perceptions that aren't real, like seeing things that aren't there or hearing voices. And disorganized thinking can show up in a bunch of different ways, from jumbled speech to, like, really unpredictable behavior.
Got it. So then the big question is, how can medical conditions cause these mental symptoms? It seems kind of backward.
It is, and it all comes down to the brain. You can think of it like a really complicated machine. It needs the right fuel, the right environment, all its parts working together smoothly. And a medical condition can throw a wrench into the works in a few different ways.
Okay, following you. Can you give me like some concrete examples?
Sure, some conditions directly mess with the brain's structure. Think about like a brain tumor. Depending on where it is and how big it is, it could be physically pressing on parts of the brain that process emotions, interpret sensory input, or even form memories.
Like it's disrupting the brain's actual hardware.
Yeah, exactly. And that can cause a whole range of symptoms that could easily be mistaken for a psychiatric problem.
So it's like a physical short circuit in the brain's wiring.
Exactly. But it's not always about damage like that. Sometimes it's about chemical imbalances. You mentioned vitamin deficiencies earlier, and it turns out those can play a huge role. Like, take vitamin B12, for example. It's super important for maintaining the myelin sheath, which is like insulation around nerve fibers, right? That insulation helps the signals travel efficiently between brain cells. But when you're deficient in B12, that communication gets all messed up. And that can lead to a bunch of different neurological and psychiatric symptoms, including psychosis.
Wow. So even something as simple as a vitamin deficiency can have these huge effects on brain function.
Yeah, it's pretty amazing, right?
What about those hormonal imbalances I read about in the material you sent?
Hormones, well, they're like powerful chemical messengers, and they have a huge impact on how the brain works. Thyroid disorders, for example, can cause big swings in your mood, your energy levels, even how you think. And sometimes these imbalances can be so bad that they trigger psychotic symptoms.
So it's like our mental state is this delicate balancing act, and even small imbalances can throw everything off.
That's a great way to put it. And it's not just hormones and vitamins. Electrolyte imbalances can also wreak havoc on the brain, like a really bad sodium deficiency. That can cause confusion, agitation, even hallucinations.
Yeah.
Because these electrolytes are essential for neurons to work properly. So if their balance gets disrupted, it can have a huge impact on the brain.
So we're talking about a whole spectrum here, from direct physical damage to these more subtle chemical imbalances. But they can all potentially disrupt brain function and manifest as psychosis.
Exactly. And then to make things even more complicated, some substances can actually trigger psychosis directly, or they can cause problems when someone's withdrawing from them, which can also look like psychosis. Yeah, it's almost like these substances hijack the brain's reward system. You get this surge of dopamine, which feels great at first, but it can have some really negative consequences.
Right, like take cocaine.
Exactly. Cocaine blocks the reuptake of dopamine, so it basically floods the brain with this feel-good chemical.
Yeah.
But that overload can also lead to paranoia, anxiety, even those really strange delusions we talked about, like thinking you have superpowers or that the government is after you.
Oh, yeah, that's a good point about the bizarre versus non-bizarre thing.
Yeah.
One of the journal articles I sent you mentioned that that can actually be helpful when doctors are trying to diagnose someone.
Oh, yeah, absolutely. When doctors are evaluating someone who's experiencing psychosis, they look for clues to try and figure out what's causing it. And the content of the delusions can sometimes give them some hints, Like if someone has a delusion that's totally out there, like believing they can control the weather with their mind, that might point towards a primary psychiatric disorder like schizophrenia.
Yeah.
But if the delusion is more grounded in reality, like maybe suspecting a partner is cheating, well, that could stem from a whole bunch of things. Anxiety, depression, or even a medical condition that's affecting the brain.
So it's like a detective game trying to piece together all the clues to figure out the root cause.
Exactly. And it's not just about what the delusions are about. The type of hallucination someone's having can also be really informative.
Mm.
Auditory hallucinations like hearing voices are common in a lot of conditions, from schizophrenia and bipolar disorder to even some types of dementia.
You know, one of the personal notes you sent in talked about having these really vivid auditory hallucinations during a super stressful time.
Mm.
And it really highlighted how real those experiences can feel, even though they're not actually happening.
That's so important to remember. For the person going through it, these experiences are very real, and it's crucial to approach these situations with a lot of empathy and understanding. And actually, stress itself can be a big trigger for psychosis, especially for people who might already be vulnerable because of genetics or maybe past trauma.
Oh, so it's like stress just adds fuel to the fire.
Yeah, that's a good way to think about it. And it really highlights how important it is to manage stress, both as a way to prevent psychosis and as part of a treatment plan for someone who's already experiencing it.
That makes sense. Speaking of treatment, what's the first step if someone's experiencing these symptoms? Where do they even begin to look for help?
Well, the most important thing is to get a professional evaluation as soon as possible. A primary care doctor is a good place to start, but often it's necessary to see a psychiatrist as well, especially if they suspect a primary psychiatric disorder.
One of the research articles you sent actually emphasized how important it is to rule out any medical causes before just assuming it's a purely psychiatric issue. They had this case study about a woman who was initially diagnosed with schizophrenia, but it turned out her symptoms were actually caused by this rare autoimmune disorder that was affecting her brain.
That's a perfect example of why a thorough medical workup is so important. It's not about jumping to conclusions. It's about systematically going through all the possibilities. So that might involve taking a detailed medical history, doing a physical exam, running blood tests to check for things like infections or metabolic imbalances, and maybe even getting brain imaging scans to rule out any structural problems like tumors or strokes.
It's like peeling back the layers, trying to find the source of the problem.
Exactly. And it's not always a clear-cut process. Sometimes there are multiple factors involved, which makes it even harder to pinpoint the exact cause. But the key is to be persistent, to keep asking questions and advocating for yourself until you find the answers you need.
I like that. Now, going back to those substances we were talking about earlier, you mentioned that some drugs can cause problems during withdrawal, which can also look like psychosis. Can you tell me more about that?
Yeah, sure. It might seem strange, but the process of withdrawing from certain substances can trigger symptoms that look a lot like psychosis because the brain gets used to having those substances around. It kind of adapts to them and starts to rely on them to function normally. So when you suddenly take that substance away, it throws the brain's balance off. And that can lead to a bunch of withdrawal symptoms, including, in some cases, psychosis.
Oh, so it's like the brain is protesting in a way.
That's a great way to put it. And one of the most dramatic examples of this is alcohol withdrawal. In really severe cases, it can cause something called delirium tremens or DTs. It's characterized by really vivid hallucinations, confusion, agitation, even seizures. It's a serious condition. It can even be life-threatening, so it's really important to get immediate medical attention.
Wow, that sounds scary.
It can be. And it just shows how important it is to seek professional help when you're trying to withdraw from alcohol, especially if you've been drinking heavily for a long time.
Okay, so we've got illicit drugs that can trigger psychosis directly, and then substances like alcohol that can cause problems during withdrawal, also leading to psychosis-like symptoms. Anything else we need to be aware of in this category?
Well, even though we tend to focus on things like illicit drugs and alcohol, it's important to remember that some prescription medications can actually trigger psychosis too.
Really? I never would have thought that meds that are supposed to help people could do that.
Yeah, it's not super common, but it's something to keep in mind. Some types of medications that are known to potentially cause psychosis include certain anesthetics, anticonvulsants, corticosteroids, and even some meds used to treat Parkinson's disease.
Huh. So it really highlights how important it is to understand the potential side effects of any medication you're taking and to talk to your doctor if you experience anything unusual.
Exactly. It's all about weighing the risks and benefits, and sometimes the best thing to do is adjust the medication or try a different approach.
Now, you mentioned Parkinson's disease. One of the research articles I sent talked about the link between Parkinson's and psychosis. What's that connection about?
Well, Parkinson's disease is a neurodegenerative disorder. It mainly affects movement, but it can also impact your thinking and mental health in big ways. Actually, up to 50% of people with Parkinson's experience some form of psychosis at some point during their illness.
Wow, that's a lot.
It is, and
Yeah.
it shows just how complicated the relationship between neurology and psychiatry can be. The exact reasons why it happens are still being studied. But it's thought that the same problems with brain chemicals that cause the movement problems in Parkinson's can also disrupt the brain circuits involved in thinking and perceiving things, which can then lead to psychosis.
So it's like the disease is affecting multiple systems in the brain, not just the motor system.
That's right. And that makes treating Parkinson's even more complicated. Doctors have to address both the physical and the mental aspects of the disease.
We've talked about a lot, but I want to go back to something you mentioned earlier. The idea that psychosis isn't a one-size-fits-all kind of thing. The research I sent you really emphasized that it's important to consider cultural and personal factors when you're trying to understand and treat psychosis.
Absolutely. We've been focusing a lot on the biology of psychosis, but it's super important to remember that culture and personal experiences play a big role in how people understand and experience these unusual mental phenomena.
Yeah, one of the personal notes talked about having visual hallucinations that were connected to their religious beliefs,
Yeah.
and it made me realize that it would be really easy to misinterpret or misunderstand these experiences if you don't take the person's cultural background into account.
That's a great example. Cultural beliefs about, the nature of reality, the spiritual world, even what causes mental illness, all of that can shape how someone experiences and expresses their symptoms. Something that might be considered a bizarre delusion in one culture might be a perfectly normal belief in another.
So it's not just about diagnosing the psychosis, but about understanding what it means to that person within their own culture.
Right. And that's why it's so important to have culturally sensitive approaches to both diagnosis and treatment.
Okay. Well, we've talked about some pretty heavy stuff today, but I want to switch gears for a minute and ask you about something that caught my attention in the research. There was an article about how certain types of therapy can actually help people manage and even recover from psychosis. Can you tell me more about that?
Sure. So, while medication is often a key part of treatment for psychosis, psychotherapy can also be really helpful. It can help people cope with the challenges of the condition, come up with strategies for managing their symptoms, and just overall improve their quality of life.
That's great. What kinds of therapy are especially helpful in these cases?
Well, one approach that's shown a lot of promise is cognitive behavioral therapy, or CBT. It focuses on identifying and challenging negative thought patterns and then helping people develop healthier ways of coping with stress and difficult situations.
So it's like retraining your brain to think differently.
Exactly. CBT can be really useful for dealing with delusions and hallucinations because it helps people understand those experiences and figure out ways to manage them.
Makes sense. Are there other therapies that are commonly used for psychosis?
Yeah, family therapy can be super helpful too, especially when psychosis is causing problems within the family. It gives family members a safe place to talk openly, address concerns, and learn how to support their loved one while also taking care of themselves.
Yeah, I imagine it can be really hard for families to deal with these situations, so having that professional support must make a big difference.
It definitely does. And there are other approaches too, like art therapy and music therapy, which can be really helpful for expressing emotions and working through experiences in a creative way.
It's like finding new paths for healing and growth. So it's not just about getting rid of symptoms, but about empowering people to live fulfilling lives, even with the challenges of psychosis.
Exactly. It's about fostering hope, resilience, and a sense of agency.
Wow. Well, I think we've covered so much today. From the biological stuff to the cultural and personal aspects, we've really gone deep into the complexities of psychosis.
We have. And I hope this conversation has been helpful and informative.
It definitely has been, and I'm sure our listener feels the same way. But before we wrap up, is there anything else you want to add? Any final thoughts or key takeaways you want to leave us with?
I think the biggest thing to remember is that even though psychosis can be scary and confusing, it's not something you can't overcome. With the right support, treatment, and understanding, people can absolutely live full and meaningful lives.
That's really good to hear. It feels like we've been in some pretty dark territory with this topic, but it's important to remember that there's hope.
Exactly. And part of finding that hope is about getting rid of the stigma that surrounds mental illness. We've made progress in understanding the biology behind things like psychosis, but we still have a long way to go when it comes to empathy and compassion.
It's like we're finally starting to see that the mind and body aren't separate. They're two sides of the same coin.
You got it. And that understanding opens up so many new possibilities for treatment and prevention. If we can figure out the biological factors that contribute to psychosis, we can potentially come up with more targeted ways to intervene.
You know, one of the research articles talked about the potential of personalized medicine in this field. It's kind of mind-blowing to think that we could tailor treatments to someone's specific genes and environment.
It really is.
Yeah.
Just imagine a future where we can identify people who might be at risk for psychosis and step in early to prevent it, or at least make it less severe. That's the ultimate goal.
It's like shifting from reacting to problems to actually preventing them, which is really exciting. But even with all these advances, I'm sure it's still incredibly tough for someone who's going through psychosis.
Of course.
Yeah.
It's important to acknowledge that. There will definitely be ups and downs, good days and bad days. But with a good support system, a strong relationship with their therapist, and a belief that they can get better, people can definitely get through those challenges and come out stronger on the other side.
I think that's a really powerful message for our listener. Hold on to hope, get help when you need it, and remember that recovery is absolutely possible.
I agree. And if there's one thing I want you to take away from this deep dive, it's that knowledge is power. The more we understand about psychosis, the better we can support ourselves, our loved ones, and our communities.
So true. And to our listener, thank you so much for sending in your materials and inspiring this conversation. We've covered a lot, but we've only scratched the surface of this really complex and always evolving topic.
Yeah, definitely. There's always more to learn and discover, and more ways we can make a difference.
So keep asking questions, keep learning, and keep pushing for a world where mental health is understood, valued, and supported. Until next time, stay curious.